Hello, Mangione. We can see and hear you.
Hello, Fausto.
Yes, we just saw a beautiful image. Yes, we just saw a beautiful image from Beneficência Portuguesa. I think, at least for my point of view, it's the largest hospital in Latin America. Is that correct?
Okay. Yes, it's more than 1,500 beds, Fausto.
So 1,500. So do you have any hospital in China with 1,500 beds?
No. Our hospital is the largest cardiovascular institute in China, but only have 750.
So this is 1,500 beds.
Yes. So it's a huge number. You can't compare China versus Brazil.
Even in the US criteria.
The population is more than 1 billion people.
Yeah, so we have here Ron Waxman. We are together here, moderation discussion again, and we have a very nice and very good discussion and panelists, Dr. Bushu, Dr. Dangas, Dr. Serraz, Dr. Saito, Adriana Moreira, Ari Mandil, Fernando De Vito, and Elio Roth, just to discuss with you. Mangione, the word is yours.
Very well known colleagues, okay. Fausto, I am ready to show you the angel of this patient. But before this, I'd like also to emphasize your invitation for my team, for my institution to be part of this important meeting again. Thank you very much. We also would like to present my team in this case, Dr. Salvador again. Everybody knows who belongs to my team. Dr. Nadia Carnieto, the nurses operators, Levi and Rita, that's helping us in this case, and Dr. Giulio Marchini. Dr. Giulio is our fellow for the first year. And we have also an important invited, in this case, Dr. Ricardo Costa from your institution. Thank you very much for your presence here. Very important to show us the IVUS results of this case. But before showing you the angel of this patient, I'm going to ask you again, Dr. Giulio Marchini, to show the clinical data of this patient. I hope this will be a very interesting case to discuss with you, Fausto. In the panel.
Thank you, Dr. Mangione. So now we have Ms. HS. She is a 66-year-old female of Japanese ethnicity. She is hypertensive, hyperlipidemic, and diabetic. She's on insulin, glibenclamide, losartan, atenolol, amlodipine, spironolactone, and simvastatin. So in the last 10 months, she's been complaining of a stable angina with minimal efforts, class 3. And she describes an intense episode of chest pain 5 months ago, which we questioned if it was an MI. So on physical exam, she's alert and well. Her lungs are clear on auscultation. She has normal heart sounds. Her heart rate is 56. And her blood pressure is 120/80. Sorry about that. She has a reduced kidney function with a creatinine clearance of 51 milliliters per minute. This is her resting EKG. You can see that she has normal sinus rhythm, but she has left atrial and left ventricular hypertrophy. She has Q waves, anterior and anterolateral Q waves with elevation of the ST segment suggestive of akinetic, dyskinetic segments. Despite that, her echo has only a mild dysfunction of the left ventricle with a 44% ejection fraction. She has mild global hypokinesia with dyskinetic apical septal and apical inferior segments with a mild to moderate mitral regurgitation. Her ERO score is 2.91%, and from a previous angiogram, she has a syntax score of 18. Thank you, Dr. Mazzoni.
Thank you, Dr. Giulio. It's important to emphasize that in spite of the EKG show the fibrosis in the anterior wall, The ventriculogram of this patient showed a good motion, almost normal motion of the anterior wall. It is important to be clear for this patient. So now, Fausto, I am going to show you the angle of this patient. You can see the right, Fausto? Can you see the right? Yes?
Yes, we can see the right coronary artery in the RAO view.
Okay. You can see he's a diabetic patient, insulin-dependent diabetic patient, and she has the pattern of a diabetic patient with a diffuse disease, not so large vessels, and this is the right coronary artery. We have the disease that begins, the most important disease begins in the mid portion of the right, and it's extending until the distal part of the right, as you can see. There is a tight lesion in the distal part of the right. Next. And the left coronary artery, you can see also diffuse disease in LAD, a calcified artery, heavy calcification in the proximal part of the artery, and the disease that extended from the proximal part until the distal, the mid portion of the artery, Fausto. And we can see also the diagonalis, the intermediate branch, is not as large, it's a small vessel, but we have also an important disease and the intermediate branch of the left coronary artery. In the circumflex artery, you can also see the posterolateral branch, important stenosis in the mid portion of the posterolateral branch. It's a small vessel. So at this point, I'd like to pass my word to you to discuss about, I think it would be important to discuss about the indication of this patient. Is a diabetic patient, insulin-dependent diabetic patient, diffuse disease, multivessel disease. What would be the indication from the panel? Percutaneous treatments or surgical treatment? I think this is a question to begin our discussion. What do you think about Fausto and Dr. Ron Waxman?
So this is definitely a multi-vessel disease in a diabetic patients. We know that the data, at least we have 2 vessels, maybe more than 2 actually, even 3 or 4. The syntax score 18 is pretty good in terms of directing to PCI, but still it's a diabetic patient. So I think it's a question of also geography. So what would you do in China on this patient? Yes, PCI or surgery?
I think for this kind of favorable PCI patient, ad hoc procedure in my hospital.
And will you do all the vessels or are you going to do staging?
It's a question about the I think LAD is no question, just standing proximal LAD. The question is RCA, maybe FFR guided procedure. I don't think we will treat circumflex.
Yeah, so you raise actually an interesting point. I mean, that remember that she has some renal failure, not complete, but her renal function is not normal, so we maybe wants to conserve about contrast. And maybe the right does not require full metal jacket. Maybe we can do FFR-guided PCI. Anyone from Brazil wants to take this his approach?
I agree with you, and I guess in this particular case, the IVUS is mandatory to know the exactly size of the vessel size, I guess.
And would you go first after the LAD or after the right?
The first LAD, sure.
Yeah. Does anyone
I have a question to Mangione. If he have thinking in use FFR, especially in right coronary artery.
So maybe her old
FFR?
From there.
Are you asking me about it?
Mangione?
FFR?
Yes, Hélio Roca here.
I understood. Okay. We didn't use the FFR in this case because it was clear that there was a tight lesion and in the distal part of this artery, and that, in my opinion, has to be treated. So in this case, I think it's more important the IVUS to show us the morphology of the artery, the grade of calcification of the artery. So in this case, we didn't use the FFR to decide to treat or not the right.
Dr. Saito, would you do in Japan the LAD first, and will you use FFR or IVUS for guiding the PCI, or are you confident that you know what you're doing without these tools in this case?
Yeah. Yes, I think we can treat the LAD first, and then for the right coronary artery, we will decide whether we treat or not, but depending on the FFR result.
But the question of staging is very important. I mean, we are actually...
No, I think for LAD treatment is very simple. So it spends just on the small cc of contrast. So then we are going to the right.
I think Dr. Saito can do this case LAD without contrast.
Yeah.
I was guided.
Which I think it's a very good point, because if you have the IVUS, you can utilize the IVUS and minimize the contrast. The IVUS can do you before, after, and... Okay, so you know what we're going to do is we're going to see how much contrast you're using for this procedure.
Maybe I can call Ashok. Would you like to join us? Maybe you see some kind of this disease in India, and maybe you can give your opinion.
Oh, I'm sure he sees a lot of this disease in India.
This kind of disease. Dr. Ashok said it's from New Delhi, India. He has a great experience with diabetes, insulin-dependent, low LDL, high triglycerides, and maybe he can give some. Mangione, what you have been doing up to now?
Okay. I'm going to show what we have done so far. We decided I think the LAD is a more important vessel for this patient, in spite of the EKG is a more important vessel for this patient. But we decided we have a lot of work to do, so we decided to leave the LAD to treat online, direct for the auditorium, the LAD. So we decided to begin treated the right one. But before showing our angio results of the treatment of the right, I'm going to ask you, Dr. Ricardo Costa, to show the IVUS of the artery prior our intervention in the right. Please, Dr. Ricardo.
Hello, everybody. It's a great pleasure to be here participating in this live case. So just for the sake of time, I think